Hey, my name's Brooke. I'm going to be your nurse today. Can I get your name and date of birth as a hand hygiene? Okay, so I verified who you are. Okay, I have doctor's orders right here confirming that I'm to do a dressing change on you today. Have you had one before? You had one yesterday? Okay, because this is a daily wound change. Okay, well, I'm going to go ahead and get everything set up, and as I'm doing that, I'm going to ask you a couple questions, okay? But first, I'm going to clean the table with hospital-grade sanitizer, and I'm going to clean around the edges as well. And then I'm going to go and put my sterile cloth over the top of it. I'm going to add my 4x4s. My gloves, tape, pin, and normal saline. I'm going to go ahead and check the expiration date on the saline, and it looks like it is in date. I'm going to take the top off of it. I'm going to, well, before I take the top off of it, hold on, before I get too ahead of myself, I'm going to get a bag and set it at the edge of the bed, so I can discard my stuff. I'm going to take the lid off of the normal saline, and I'm going to lip it, which is where you pour out, but you pour it like that and come back through. Okay, and I'm going to take the top and put it top face up. Okay, have you used the bathroom anytime soon? You have? Okay, and are you in any pain before we start this? You're not? Okay, great. Okay, well, I'm going to go ahead and get started. I'm going to put my gloves on. Okay. And then I'm going to start removal of the tape. And I'm going to start at the edges and work my way around. I'm going to look at the wound, look at the drainage, see the color, the odor, amount, and consistency, and make sure everything looks fine. And if it has a smell or anything, that way I can make sure to document that. And then I'm going to hold it up and drop it into the bag without actually sticking my hands into the bag. Okay, then I'm going to pour some saline into my gauze right here. But I'm going to look at the wound, and remember RETA, redness, edema, agnesium, or the bruising, to look at the bruising, the drainage, and the make sure that it's all together and everything's together. Okay, it looks like it has some staples in it, so it's going to have 1, 2, 3, 4, 5, 6, 7 staples. Okay, I'm going to take my gloves off now. I'm going to hand hygiene. I'm going to add another pair of gloves back on so that I can start cleaning the area. And you clean from dirtiest to cleanest. And I'm going to take where my 4x4s, grab all the edges like a wonton. If it has any excess water, I would squeeze it out. And then I'll take it and I'll clean from cleanest to dirtiest. So I'm going to start at the bottom, work my way down. I'm going to discard, grab another one, work from the furthest part away from me, and work my way down. Discard of that one, grabbing another one, work my way down the other side and discard. And then I'm going to take get a clean dry one and dab any wetness so that the tape will stick onto the patient. Then I'm going to reach my hand and just pinch the top to cover. Oh, and then I'm going to measure the wound also. Before I do this, I'll measure. But I will lay this on top, grab another one that I have pinched, lay it on top, and then add one more. And now I can take my gloves off. I will hand hygiene. And I'm taking my gloves off because that way I can work with the tape better. I'm going to make a photo frame type of tape here. I'm going to add it here. Add a piece here. Add a piece here, making sure that the patient's okay during this time. Make sure they're not showing any discomfort. Okay. And then I'm going to take another piece of tape, and on my clean area, I'm going to take my pen and write my name, date, and time. Okay. And then I'm going to stick it on to the bandage. That way that they know when it was last changed. Then I'm going to have the patient in a comfortable position with the call light in reach. I'm going to discard of the bag and discard of all of the material that I've used. I'm going to document everything and document whether it was redness or if it had any drainage tubes or anything like that. Then I'm going to hand hygiene and leave.